My name's Michaela, and I'm 20. I'm from Northbridge, and my favorite thing to do is play with my son.
I grew up in India, actually, and I grew up in Mumbai, which is a very cosmopolitan city, and I was somewhat of a nerd.
I was the perfectionist child. I was the overachiever. I did everything that my parents wanted me to do.
I spent most of my time playing basketball, actually, which I loved with a passion.
I don't look back in adolescence and relish it and think it was a wonderful time, no. And I always say to my patients, gosh, I would never, you couldn't pay me $1 million to go back to be a teenager. So I'm here to help you, but I'm not going back there with you.
When our patients come into the door, they need to feel that they're in the right place. In that, they need to feel that it's age appropriate, that they're not surrounded by crying babies, that they are spoken to as if they are adolescents and not children.
I hope that they feel welcomed at the front desk, welcomed by the nurses, and then once they're in the room with us, that they could smile a little bit, because it's a very nerve-wracking experience for them. And that they feel when they leave that they have somebody in their corner, somebody that's going to work with them and fight with them and help them with whatever they need.
When I found out I was pregnant, his father decided to join the Marines. I've always been pro-choice, but I couldn't do that myself. But I knew I had, after a while, the support of my family.
I didn't even feel like myself. I'd go into school, couldn't even concentrate. If a teacher could be sitting at the whiteboard, typing something up, drawing something up, writing anything, and all I would hear is Charlie Brown noise. You know, that teacher, that little womp womp.
I do remember the first time I ever forcefully vomited. And to be honest with you, it felt great.
There are phases of life in which parents cannot address some of these issues because teenagers find it hard to talk to them about it.
Darlene actually brought us all in to the office, Michaela, myself, and Darlene. And so we sat down and had a nice talk, and Darlene gave us a lot of pros and cons and helped Michaela make the decision she had to make.
It really meant a lot that I actually knew that I had someone that, she knows me, she knows my family, she kind of knows how I feel about that kind of stuff, and it was good to have someone that understood to talk to.
On one hand, we try to address these issues ourselves, whether they be medical issues, psychological or emotional issues, but on the other hand, we try to open up lines of communication between the teenagers and their parents.
I was so resistant to going there. My mom had to drag me in. I didn't want to be there, I didn't want to talk to anybody, I didn't want to give any information, and I didn't give any information for a long time.
So these kind of kids, you just take the extra time, you follow through things till the end. Like if they have a need that needs to be met, you don't kind of say, oh, that's someone else's job to do. You try to see it through right to the end.
I am diagnosed with ADHD when I was in 2nd grade, and we never could really get my pinpoint what type of drug would help me concentrate better in high school. And actually that's when I started seeing Dr. Gupta. It was about my freshman year, and she really was able to fine-tune what I needed just to give me that extra little focus to keep me looking at the blackboard instead of out the window.
I think that teenagers, most of the issues that they experience will have taken time for them to get there. It'll take as much time for them to get better. Although there are some who turn around really quickly because they just need the right fit.
My grades in junior and senior year were almost all straight A's. And I went from being almost failing to straight A's. I actually was able to graduate with a 3.4, which I'm ecstatic about.
I did start opening up to one of the nurses at the Adolescent Center and to my nurse practitioner that I did see over there. So those were the first people I really started opening up to.
And why them?
Because they took the time. Sorry. Give me a second.
I see it as a really difficult time for teenagers, but I also see that there's so much potential in them and there's so much that they're going to do in their lives, and it's just a phase or a stage, which when you're in the middle of adolescence, you can't see it's just a phase. It's the end of the world. But I think I can bring some perspective to that and some support, and that's what I look to do for them, and I love working with them.
They really took the time to listen to me without my mother in the room and with my mother in the room. So They were friends to me. They weren't there to tell me I was wrong. They weren't there to tell me that, you know, I had issues. They were there to help me through my issues.